Unit 10 is on fluid balance in the urinary system. So looking at the diagram that we have here, I want to point out the length of the urethra in comparison, the male compared to the female. The urethra is quite a bit shorter in a female, and so they're more prone to having urinary tract infections when you don't wipe properly. If you wipe back to front instead of front to back, that can happen a lot easier in a female than in a male. So I wanted to point that out, but you can also see they have other things listed on this diagram. So changes in the urinary system due to aging. We know as you age that the kidneys don't filter as efficiently, the bladder muscle tone tends to weaken, or the bladder holds less urine, which can be more frequent urination. So for a CNA, what this might mean for your elderly clients is that they may need to use the bathroom more often than what somebody else might need to, or they may not be able to hold their urine. And sometimes the bladder doesn't empty completely, and this can put them at a higher risk for a UTI. So a UTI is a urinary tract infection. Most common cause of it is E. coli. It's usually caused by bacteria. Prevention, drinking lots of fluid, which we know those that live in the nursing homes or long-term care typically don't drink enough fluid, so we want to always be offering them water. And then hygiene, which we talked about, wiping front to back is very, very important. Another disorder of the urinary system is chronic renal failure. And this is when the kidneys are unable to function effectively. And this can be a result of other diseases that can damage the kidneys. We talked about diabetes and about how there's all these little small vessels and capillaries that feed the kidneys, and the high blood sugars can damage those. High blood pressure or hypertension also is another disease that can cause chronic renal failure. So the damage of the blood pressure being high over long term. Chronic urinary tract infections, kidney infections, certain medications, all of that. If a person has chronic renal failure, it's very possible that they might need kidney dialysis. And so that's something to be aware of. Another issue to be aware of is urinary retention. And this is the inability to adequately empty the bladder. So a cause of this could be surgery, or if there's some kind of obstruction or infection that may cause an issue there. If a person has urinary retention, they may need to be straight cathed to get some of that urine out, or to see how much they're holding. You can read about catheters in your textbook, pages 305 to 310. A catheter is a tube that's used to add or drain fluid, and it's inserted through a body opening. So when we think about urinary catheters, they're inserted into the bladder, typically to empty urine from that. So a straight cath, I just talked about that a little bit with the urinary retention. That is inserted in, but it doesn't stay in the body. It doesn't stay in the bladder. It's just inserted to empty out what's in the bladder, and then it's removed from the bladder. It doesn't stay there. It can be used to collect sterile urine specimens. It can be used for urinary retention. There's lots of different methods or reasons to use a straight cath. Indwelling catheter, that is what's inserted into the bladder through the urethra, and it's held in place by a balloon that is inflated with sterile water. So this picture here will show you some indwelling catheters, and you can see the balloon that's inflated and that holds it in place. So that's an indwelling catheter. You're going to want to look in your textbook at page 308 on how to correctly empty a catheter drainage bag. There's also, I believe, a video that I put in the video section you can take a look at. This is showing you a picture of that. There is a procedure. You would want to wear goggles because there is a potential splashing of the urine or body fluids into your eyes. Of course, gloves. You'll have a barrier device that you'll put down. You'll clean the spout with alcohol swab to make sure you're not introducing any infection. So make sure you read through that process. There's a couple other things. So there's a condom catheter and a leg bag, and these are things that you should be familiar with. A condom catheter goes over the penis and it helps to drain urine. So it's not inserted into the body, but it's an external type of a catheter. And then a leg bag is just a small drainage bag that's secured to the leg. And so it makes the person who's using this a little bit more mobile and able to get around. Okay, so let's talk about fluid balance. Fluid balance is taking in or eliminating equal amounts of fluid, and it doesn't have to be exactly, but it should be very close. So a normal fluid intake is 1,500 to 2,000 mLs in a 24-hour period. And then so the normal fluid output is the same, 1,500 to 2,000 in a 24-hour period. So if a person has edema, and you'll need to be familiar with what this word means, edema is when there's fluid overload. More fluid enters the body than can be eliminated. And this can happen when the heart, lungs, or kidneys are not working properly. Those things can certainly affect that. So we have to watch for that. What are some signs and symptoms of fluid overload? Well, weight gain is usually the first symptom before you see anything else. So a person who has heart, lung, or kidney issues may be on daily weights. And it's important that they're weighed properly, because if they have a weight gain of 2 to 3 pounds, the doctor may treat them with a diuretic to pull off that extra Lasix. So weight gain can be definitely a sign we're looking for. Difficulty breathing, swelling in the feet, ankles, or fingers, decreased urine output, or their skin can be tight, smooth, and shiny, and that's because of that extra fluid that's pushing against that skin. Dehydration is the opposite of fluid overload. It is a fluid deficit. And so the fluid output exceeds the fluid intake. Possible causes could be poor fluid intake, vomiting, diarrhea. The signs and symptoms of dehydration, that would be like thirst, dry mouth, mucous membranes. They can have sunken eyes, dark urine. You may also notice dehydration in their vital signs. So their blood pressure may be low, and they may have an irregular heartbeat. All right, when you are measuring intake and output, remember that all liquids taken by mouth should be included. And that's clear liquids, full liquids. IV fluids should be included, and tube feedings. So that's for intake. Output should be urine, any kind of liquid stool, vomit, wound drainage, or you have to keep in mind sweat or perspiration. You can't measure it, but like if you've had to change their bed twice because they've been sweating so much, that's something that should be indicated in the chart somewhere. Measuring I&O, this is an ongoing process. You're going to measure and record all fluids taken in and eliminated over a 24-hour period. And this is totaled for each shift and then added for a 24-hour total. So we will do some practice with measuring I&O, and you will have to check off on this skill. Something very important to know, and I know I talked about it with you guys earlier in a previous video, but 1 ounce equals 30 mLs. And you have to know this, and you have to be able to do these conversions. So 1 ounce equals 30 mLs. So if you have 8 ounces of juice, you take 8 times 30 and you convert it to milliliters, and that's 240 milliliters. You're going to record the fluid I&O in milliliters, and then there are conversion charts in your book, page 266. So if you struggle with doing this kind of math, you do need to do some practice, and there are some practice sheets in the worksheet section, I believe, that you can go through and do. Fluid output is measured in a graduate pitcher, and there is some guidelines for that on page 266 to 267. Make sure that when you are reading the measurement, that is on a flat surface so that you're getting the accurate number. If the person is NPO, that means nothing by mouth. Nothing, nil per os is what NPO stands for, but it just means nothing by mouth. So their water pitcher will be removed from the bedside. Restrict fluids. if they are on a restricted fluid, it may be because they have a heart or kidney issue. And so the fluid intake is limited to a set number by the physician. They won't have a water pitcher in their room. They are given fluids at certain times of the day, so like at their meals, with their medications, and then they may have a little bit of free fluid, a certain amount at other times. And this can be for somebody who has congestive heart failure or kidney failure. Forced fluids is when you want to be offering those fluids frequently. You ask them what they prefer, you keep that water pitcher at their bedside, you offer assistance, you're wanting to frequently be getting them to drink. And then the last few slides here are about specimen collection and isolation, and you'll want to go back and look that over in your notes. If the person is in isolation, you're collecting a specimen, let's say a urine specimen, you're going to have two labels. One label is outside the room with a biohazard specimen bag. You're going to put your PPE on. You're going to take that specimen container and one label into the room. Then when you go into the room, you're going to place that one label on the specimen container, remove your PPE. I'm sorry, this is after your specimen collection. You're going to remove the PPE and wash your hands. You're going to pick up that specimen container with a clean paper towel and leave the room, immediately putting it into that biohazard bag that you've left out on the isolation cart. Then you're going to discard that paper towel. You're going to seal up that bag. You're going to take that to the proper place, which would probably be the lab, and wash your hands. And so look that over, those collection guidelines. They're on pages 310 through 314. There's always going to be questions on your state test about specimen collection. So you want to be familiar with this. There also is a handout in the handout section on specimen collection, and it has all different kinds of specimen collection. So please take time to read through that and review that before you take your state test also.